Streptococcus are gram-positive cocci which are arranged in chains. They grow poorly in simple medium, but they grow in enhanced by addition of glucose, blood, and serum. Classification: aerobic and facultative anaerobic streptococci are classified on the basis of their hemolytic properties. Three types of hemolytic reactions: alpha, beta, gamma, observed on blood agar medium. The beta hemolytic streptococci were classified as classified in 1933 serologically into 20 groups named A, V without I and J. These groups are based on the nature of carbohydrate C antigen on the cell's wall. Majority of the streptococci that produces human infections belong to the group A, named as a Streptococcus pyogenes. These are further divided by the type specific antisera into approximately 80 Griffith serotype type 2, 1 and 2 based on the surface protein MTR. Streptococcus pyogenes morphology: the individual cocci are spherical or oval, 0.5 to 1 micrometer in diameter and are arranged in chains. The streptococci are gram-positive, non-material and non-sporing. Streptococci in presence of oxygen requirement, aerobic and facultative anaerobes, obligate anaerobes. Example: peptostreptococci. Aerobic streptococci and facultative anaerobes on hemolysis. It forms alpha hemolytic, that is virulent groups. These are classified into species by physiological and biochemical properties, and it is next to beta hemolytic. The beta hemolytic on serological group C grouping, serological grouping, carbohydrate C, it forms 20 lancified groups: A, B, C, D, E, F, G, H, K, L, M, N, O, P, Q, R, S, T, U, V. The group A Streptococci pyogenes. On serological typing, M protein, Griffiths type 1, 2, 3, etc. up to 80. 3. Gamma hemolytic streptococci, the Enterococcus group. These are classified into species by physiological and biochemical properties. Cultures: they are aerobes and facultative anaerobes growing best at a temperature 37 degrees centigrade. They grow only in the medium containing blood and serum or sugar. On blood agar, after overnight incubation, the colonies are small, 0.5 to 1 millimeter, pinpoint, circular, semi-transparent, low convex, with a wide zone of beta hemolysis around them. The crystal violet blood agar containing 1:5 lakhs crystal violet is a selective medium for streptococci. Another selective medium is the PNF medium, horse blood agar containing polymyxin B sulfate, neomyxin sulfate, and fusidic acid. In liquid medium such as glucose broth, growth occurs as a granular turbidity with a powdery deposit, the bacterial chain being heavier, settled down as deposit. Biochemical reactions: catalase negative, PYR test positive, ribose fermentation negative. The antigenic structures. The antigenic structures of streptococci pyogenes is shown in the figure. Toxins and enzymes. Toxins: the hemolysin, streptolysin, both streptolysin is the pyogenic exotoxin, enterogenic toxins. Enzymes: streptokinase, fibrinolysin, deoxyribonuclease, streptodornase, nicotinamide adenine dinucleotidase, NADase, hyaluronidase. Disease: the Streptococcus pyogenes produces a pyogenic infections with a tendency to spread locally. The non-suppurative sequels of the local infection includes acute granulonephritis and rheumatic fever. The disease caused by the Streptococcus pyogenes and other streptococci are shown. Differentiating features of acute rheumatic fever and acute granulonephritis are listed. The pyogenic infections, respiratory tract, acute tonsillitis or pyogenes, sore throat, scarlet fever, skin infection of wound, burns and skin lesions, erysipelas and impetigo, genital infections, pleural sepsis, deep infections, bone and joint infections, lymphadenitis, septicemia, abscesses in internal organs, non-suppurative complications, rheumatic fever, acute glomerulonephritis. Group B Streptococci, the neonatal infections, Enterococcus faecalis, urinary tract infections and enterocarditis, virulent Streptococci, endocarditis, dental caries. Laboratory diagnosis. The diagnosis of acute suppurative infections is made by culture, while in the non-suppurative complications, the diagnosis is mainly based on the demonstration of antibodies. Acute suppurative infections specimen. The specimen is collected according to the site of lesion, swab, pus, blood, and CSF. Collections and transport. The specimen should be collected in a sterile container under all aseptic conditions. These should be plated immediately or sent to the laboratory in a peak transport media. Blood agar containing 1 is to 1 lakh 10 lakh crystal violet. The gram staining of smear. The gram positive cocaine chain is indicative of streptococcal infections. The smear are of no value where streptococci are present as part of resident flora, such as in infections of throat and genitalia. Smear examination is important in specimens such as pus and CSF culture. The specimen is inoculated on a blood agar medium and incubated at 37 degrees centigrade for 18 to 24 hours. The hemolysis developed better under anaerobic conditions or in presence of 5 to 10 percentage carbon dioxide. Colony morphology and staining. The colony of streptococci are small, 0.5 to 1 millimeter size of pinpoint, circular, low convex with the zone of beta hemolysis around them. Liquid medium, example glucose broth. Growth occurs as a granular turbidity with a powdery deposit. The gram staining from the colony shows gram positive cocaine chains. The hanging drop preparation from the liquid medium shows non-motile cocaine. Biochemical reactions: catalase negative, PYR test positive, ribose fermentation negative. The identification of various groups of streptococcus. Streptococcus pyogenes group A, more sensitive to bacteriocin, 1 unit per ml than other streptococcus. Group B streptococcus, cyclic adenosine mono CAMP reaction is positive. Group D streptococci heat resistant test is positive. Lancified group. The hemolytic streptococci are grouped serologically by the Lancified technique. The Lancified grouping depends on the C carbohydrate which is specific for each group. The C carbohydrate is extracted from the cell wall of the streptococci and grouping done by a precipitation test with a group and zero. Non-suppurative complications in rheumatic fever and glomerulonephritis, a serological test provides a retrospective evidence of streptococcal infections. The routine test done in anti-streptolysin ASO titration. A titer of 200 units or more is significant in rheumatic fever and is indicative of prior streptococcal infections. The ASO test is a neutralization test. The anti-deoxyribonuclease B, anti-DNase B test is more reliable for retrospective diagnosis of streptococcal pyoderma, for which ASO is of less value. The titer higher than 300 or 350 are significant. This test is very useful in cases of glomerulonephritis. Other hemolytic streptococci. Group B streptococci. The Streptococcus agalactiae is an important pathogen of bovine mastitis in cattle. In recent years, it has been recognized as a single most important pathogen in neonatal, causing the neonatal septicemia and meningitis. It may also cause a septic abortion and puerperal sepsis. The presumptive identification depends on the ability of the organism to hydrolyze C-purate. Another test to identify group B is the CAMP reactions. The Christian, Atkins, and Munch Peterson, which was demonstrated by the productions of accentuated zone of hemolysis as butterfly appearance when the group B streptococci are inoculated perpendicular to a streak of staphylococcus or is grown on blood agar. Group D streptococcus. Streptococci belong to the group D or classified as a enterococci, fecalis streptococci, and non-enterococcus, non-fecal streptococci. They are usually non-hemolytic. The enterococci group has been reclassified as a separate genus called enterococcus. The group D streptococci are inhibited by 6.5% sodium chloride or 40% bile. This may causes genito urinary infections or endocarditis. Rarely the enterococcus also belonging to the group D, as they contains the same antigen as that of group D streptococci. They are normally inhabitant of human intestinal tract and possesses some distinctive properties as follows. They are positive for bile acetylene hydrolyzed test. They are relatively heat resistant and can withstand heat at 60 degrees 60% 60 degrees centigrade for 30 minutes. Heat test or heat resistant test. Their ability to grow in the presence of 6.5 percentage of sodium chloride. Their ability to grow at 45 degrees centigrade and at pH 9.6. They are PYR test positive. They are resistant SXT trimethoprim sulfamethoxazole. On McConkey medium, they grow as a tiny, deep pink colonies. On gram staining, the enterococci appears as a pairs of oval colonies and short chains. The Enterococcus faecalis is the most commonly isolated enterococcus from the human sources. Other enterococci are Enterococcus faecalis and Enterococcus durans. Enterococcus faecalis is frequently isolated from the cases of urinary tract infections and wound infections. They may also cause other infections like subacute bacterial enterocarditis, septicemia, peritonitis, and infections of bilateral tract. The strain resistance to the penicillin and other antibiotics occurs frequently. The vancomycin is the primary alternative drug to penicillin for treating enterococcal infections. Vancomycin resistant enterococci have also been isolated. The enterococcus can be differentiated from the group D streptococci by the number of tests as shown in the table. The difference between the enterococci and group D streptococci: the enterococci, the bile acetylene hydrolyzed test. Enterococcus positive, group D streptococcus positive, growth in the presence of 6.5% sodium chloride. Enterococcus positive, group D streptococcus negative. PYR test, enterococcus positive, group D streptococcus negative. Sensitivity to SXT, enterococcus resistant, group D streptococcus sensitive. The ability to grow at 45 degrees centigrade, enterococcus positive and group D streptococcus negative. Burden streptococci. This group of streptococci produces alpha hemolysis on blood agar. They are commensals on mouth and upper respiratory tract. This group contains many species of, for example, Streptococcus salvarians, Streptococcus mutans, Streptococcus sanguis, and Streptococcus milleriae. They are ordinarily non-pathogenic, but on occasion causes disease. The virulent Streptococci are associated with the dental caries and subacute bacterial endocarditis. They causes endocarditis in persons with predisposing factors such as valvular disease of heart, congenital heart disease, and cardiac surgery. The important laboratory tests for diagnosis of different group of streptococcus are shown in the table. Streptococcus lanciferi group A, Streptococcus pyogenes diagnostic test, bactericin sensitivity, PYR positive, ribose not fermented, resistant to SXT, Streptococcus agalitae, CAMP, test positive, hypurate hydrolysis positive, resistant to XST, Streptococcus dysgalactiae subspecies Equus ribose fermented, tree halose fermented, Enterococcus species. Bile acetylene test positive, heat test positive, growth in the presence of 6.5% sodium chloride, PYR positive, resistant to SXT, non-enterococci. Bile acetylene test positive, no growth in 6.5% sodium chloride, PYR negative, and sensitive to SXT. Verdant streptococci, optochin resistant species differentiations on a biochemical test.